Hi there, my name is Mariana Orozco. I am a traditional Chinese medicine practitioner and acupuncturist. And today I want to translate what that means. Traditional Chinese medicine is an ancient way of medicine. It's a totally different medical system. If we're comparing the allopathic or biomedicine medical system and traditional Chinese medicine, we are talking about two totally different entities. They were developed in different times in history. Their terminologies are different. And the most beautiful part of it is that we are not meant to replace one with the other. We are made to complement each other. Traditional Chinese medicine uses a different approach to your health concerns. We don't treat symptoms. We treat the person, and we try to identify the root of the problem. And we treat most of the time the root of the problem and the branch, which is the symptoms. Sometimes we do that simultaneously. Sometimes we treat the symptoms first if they're more concerning, and then we will focus our attention in treating the root of the problem. But well, that's in general terms what we do. We also work alongside with the biomedical system. I have patients that are undergoing chemotherapy or they're post-surgery, and we work together. We are trying to integrate our two medicines to give our patients a better care, a more centered patient health care. And that's very beautiful. That's what I love so much, what I do. What you can expect is not just acupuncture. I know acupuncture, the needles are the most famous part of traditional Chinese medicine, but there's so much more than that. We also do, because we are a holistic system, we treat the patient as a whole. We will talk about diet and nutrition, what type of foods are better for the different type of medical concerns. Constitutions plays a huge role in traditional Chinese medicine, and it's very personalized. Also, emotions for us are pathogenic factors, which means are cause of diseases. And we will spend more time with you learning your symptoms and your signs, and once we have a diagnosis, I spoke about how to get there, how we get to the diagnosis, the traditional Chinese medicine diagnosis in a previous video. But once we have a diagnosis, what can you expect as a treatment? Not just acupuncture. It's not just about stabbing people. It's not just about needles. We have so many different modalities that we do. Cupping is the number 2, like famous, like popular wise. Cupping, like using glass jars with fire or different types of materials, is probably the second most famous. But we also have Trina and moxibustion, Qigong, Tai Chi, food therapy or dietary therapy, which is Shilao and Pinyin. There's so much more that we can do, and I'm going to be doing small videos describing the differences between the different modalities that we traditional Chinese medicine practitioners can do in a treatment protocol. And sometimes we don't even use needles. We can do acupressure, we can do a therapeutic massage, which is Trina. But we'll talk more about each of them in different videos to come. I hope this is somehow more informative to you. And if you are afraid of needles, I never liked needles before, but now I am, well, of course I have a different perspective, and I have experienced the benefits of the treatments. But as I said in the beginning, it's one of our tools, but it's not the only tool that we can use in clinical practice for treating different health concerns. I hope this is informative and that it's good for you to know that if you don't like needles, we still have other choices and other treatment modalities that we can use to help you feel better. Again, my name is Mariana Orozco. It was great seeing you today, and take care. See you in the next video.